What is migration that we hear people talk about so much?
If you look at the lips here, there is a red portion of the lips. There's something called the vermilion border, which is where the red changes to not red. And then just above that, there is what's called the white roll. And so lip filler migration is when lip filler is in the lip, but then moves upward into this area above the lip. Unfortunately, it causes this duck-like appearance, kind of a, you're coming like that. What do you say about a woman in the room?
If your lips enter the room before you do, we might need to have a conversation about it.
Right, that is not a good sign. And it distorts the beautiful shape. The beauty of the lips, part of the beauty is that crisp border, and unfortunately it can detract from beauty by doing that. So lip filler migration is when the filler is either in the lip and moves up, migration, or sometimes it's generally placed incorrectly in the first place. But the migration part is when it moves.
Lots of people have lip filler walking around now. How are we supposed to know if we're migrated or if it's normal, if it's the white roll? What are we looking for?
The biggest thing first is to look at the profile. In the proper lip profile, the area that is white should be lower, and then it should go up like a ski slope to the vermilion border. So in your beautiful face, this white area comes down, and then there's an uptick at the level of the vermilion border. There's some shadowing here, but if this were just one surface that just blends into this, that's not a good look, and that indicates there's migration going on.
How, as a patient, can you prevent that from happening?
You really want to do your homework a little bit and find the right med spa and the right injector.
Anytime we are talking about medical aesthetics, it is a combination of a medical treatment and an artistry. Every injector has their own little unique style. Look at their work. If you find an injector that's got a really great deal, but they have no before and afters, they have no credentials, you're really taking a risk there. You've got to do your homework, look at pictures, ask questions. Are they, constantly training and learning new techniques? Are they using safe injecting techniques? Finding the right injector is incredibly important. You will have better results in the long run, and you will be happier if you spend that time in advance looking for the right fit for you.
Getting treatments is a whole experience, so I think you also need to trust your gut, and if a place looks whatever good for you, not clean, not safe, or it's just not genuine, I would think twice about that. It's important that the whole experience be good, not just in the room itself, because it's really about much more than just the filler.
So what other things are important for patients to understand when we're talking about, preventing migration?
I think patients need to be aware and have realistic expectations for their own anatomy. If you have smaller lips and you have this aspiration and you come in with a picture of someone with really genetically big lips, and you are shooting for that and you really want to achieve that, I think that is a setup for migration, because over time you're pushing beyond the natural anatomy and it's going to push beyond that border.
If you get lip filler, you absolutely love it, you are ready to get more. How long should we be waiting in between treatments?
When you choose an injector, you're choosing a lot of things. I personally believe that unless someone comes with just huge, natural, capacious lips, I generally tell patients a minimum of 6 to 9 months, and most likely a year. This stuff lasts a long time in the body. Even if it's not clinically apparent, MRI studies now have shown up to 15 years there's still traces of filler. And if you think about it, the reason we're here talking about lip filler migration is because we don't see cheek filler migration, okay? Filler in your cheek does not go up to your temple or fall down here. The reason the lips have a migration issue is because it's a tight space. There's not a lot of room in here. Pace yourself. Go to an injector who is a cautious injector. It will pay off dividends in the long run. of not having to go through the whole dissolving scene and everything.
So you've done your research, you found an awesome provider, an awesome med spa, you know your post-care instructions, you are prepared and ready to go. But you heard that your friend got this specific filler and had a really great experience, and that's the one that you want too. Do you ever get that in the treatment room?
Which filler is used in your lip is very important, okay? It is very important. It's not the ultimate importance, but it's very important because fillers have different properties. It's fine to talk about a specific product. Your injector has experience in their hands. They know what works well for them. They know what works well in your type of lip. So it can be a dialogue, but at the end of the day, I tell my patients respectfully, I appreciate what you're saying, but in my hands, this is what I would use for you, and I get the best results with that.
So how can you prevent filler migration? As a patient, you can do your research, find the right provider, find the right med spa, allow your provider to counsel you on product choice and on frequency, and know your anatomy and understand the limitations there.
And no working out, no making out for a couple of days. I love it. It's such a catchy phrase.
It is.
I came up with that. I kind of like that one. Thanks for joining us. We really appreciate this. I hope this is of value. And if it is, we've got lots more content for you, don't we?
Absolutely, absolutely. Check us out.